with this, I invite Dr. Mishra from uh, uh, South Delhi district to talk about, quickly take maybe 3 minutes or so, and talk about the innovations that he did much before in terms of the contact tracing and the launch of our Setu app, for instance. Dr. Mishra.
Yeah, thank you very much for giving me this opportunity to discuss and share my experiences. See, all whatever we did was a requirement of the time. And we first started at when there were institutional quarantine, and we were sending these people also into the home quarantine after 7 days or 14 days. And the people who are not strictly following the home quarantine, then the problem arose at how to trace them and track them. Then we developed a mobile-based, web-based application, GPS enabled. And we took the permission from MHA because we were tracking the locations of the public, and then we got the Ministry of Home Affairs gave us permission to download it with the permission of the consent of the person. And then there is a very beautiful desktop in which if beyond 50 meter of fencing the person goes out, he also gets an alert, and we also get an alert into our control room. And you will be happy to see that the person, in fact, on the desktop, what we have seen, that at 3:40 p.m. the person was out, and as soon as he got the alert, 3:40 p.m. 43 seconds he was inside. Means even in the when I saw this, that 3:40 p.m. the person was out, as well as on the very same time 3:40 p.m. he was inside. Then I asked my people, how can it be possible? Then they went into the seconds, and then it was seen that he got the alert, and he was on the very next 10 seconds he was in. So this helped us a lot in tracking the home quarantine persons. Also, we took the assistance of police by the CDR location, other things also very useful. Then we went to the containment, and containment was big in size, and 1,000, 2,000 people and households, they were to be surveyed for ILI symptoms, and then tests were to be administered. And then this was manually, I got it done in 1 or 2 containment survey. Then number one, it was labor intensive. Number two, the decisions were to be taken in pen and paper, and it was very cumbersome. So I thought of doing it by way of just on the screen this voting has come. So I thought of doing it with the help of one app, and then this containment survey application, which is both these apps have been deployed for the whole Delhi, and also some of the other UTs have also taken. So based upon this app, with certain set of questionnaire, like 4 questionnaires for the contact history and the 4 questionnaires for the uh, symptoms, we survey the people, and the desktop live data is populated, and amongst those data we can immediately filter which person is having severeness of the symptoms, like shortness of breath and other things, and immediately we mobilize the ambulances. So life can be saved. And also the decision making for administering tests or mobilization to the hospitals or the home isolation and other things, home quarantine, they are very easy for a large set of population. Also later uh, in few days, MHA was asking how many containment survey have been done, how many people. So we had the whole data in an Excel sheet, and we could download it and give it to them. Then came the problem of testing. Means people were to be taken to Ram Manohar Lohia hospital in ambulances, and then this cumbersome procedure of taking them to hospital and then bringing them back, and then a risk of contamination of the negative persons taken to hospital, or from the persons who have been taken to the hospital. We try to find out a testing ban on wheel. Then CRPF donated 2 of the buses, and the state-of-the-art mobile testing buses we devised. And the features are available on the exhibition page also, that helped us immensely and increased our testing capacity to unlimited extent with the round-the-clock deployment of these 2 buses. We further went on to, like, when the number of cases were increasing because of more of the opening up and other things, and people not following the safety guidelines. We tried to put in more and more information, IC activities, more and more social communications, media communication, other things. But Delhi has its own problem of being metropolitan of capital city and adjoining states and other things. So the containment decisions were getting very cumbersome, and the manual task was very difficult. So I thought of devising one artificial intelligence with whom we can take the containment decision. Like in Delhi, we have a micro containment policy of 3 cases. If they get clustered, you can contain the locality. So that also I've just today I have deployed that application as well, and now Chief Secretary sir is asking to scale it up to the state level. In that, all the cases of 7 days they get populated over the Google Map, and then the 100-meter circle radius is drawn around, all around, and then we find the clustering, and then all the lanes and everything is on Google Earth is mapped, and we just need to implement that. The major problem then is in coming days is coming up, that how many patients can be institutionally placed in various hospitals and the beds are in thought. So we came up with this idea of, we have a Radha Swami Satsang Vyas in the Bhati, and we came up with the idea of creating a big hospital. In fact, we never knew that this is going to be a record-breaking hospital, but we then detailed it minutely for a 10,000 bedded COVID hospital, and it's almost in its final shape. We are getting support from the Ministry of Home Affairs with the CAPFs, and as well as Army, as well as the state government. And today also, first half fully I was there only. This 10,000 bedded hospital, we are coming up with 10% oxygenated beds, and this would be in form of uh, around 1,000 bedded hospitals into 10 multiplication, and with each 1,000 bedded unit having 10% oxygenated facility. There were lots of manpower, logistics, detailing of linkages with the pathology, referral services, ambulances, and other things, that each and every details are being minutely worked upon with the help of the some retired doctors of the MAMC, with the help of the doctors from the military and paramilitary, and this all we are expecting that very shortly by the end of this month or in the first week of July, we'll start this also. Keeping all these things in mind, having done all these things, still I would say, like the question you raised there, and while announcing these semi-finalists, you raised a very valid question that the cases are not declining and the cases are increasing. But believe me, the cases are also not increasing exponentially. The nature of the disease suggests that today it will come 1, and tomorrow it will come 5, then it will come 25, and then so on, and the cases will get multiplied. What our experience suggests that the cases are not increasing with that exponential pace. So as long as the rate of increase is stabilized, and we match it with the hospital care center, while simultaneously opening up economy, we will be able to handle the COVID, and to a certain critical level of population, what we call ordinarily as herd immunity, if it reaches, because there is no vaccine, and there is any time we open up, you see, we can't keep the economy closed for long, and anytime we open up again, the cases from 1 to 2 to 4 to 4 to 8 to 16 to 32, and this exponential graph is going to rise only, and it will only get saturated when this concept of herd community actually gets in operational terms. So our main motto now has been that to contain the disease in spreading rapidly, number one. Number two, to decrease the fatality rate with the intensive and I would say accessible healthcare in the golden hour one can reach to the patient. And to that level, we have yet been successful with the less number of mortality in Delhi in comparison to other states. More particularly in South Delhi, I have only 2.1% mortality. And also, you see the uh, our this sampling rate is, I think, best in the country. I would claim best in the country, with more of the rapid antigen test kits have been deployed since yesterday, day before yesterday. And we are every day, every district is getting almost 3,000 tests per day. So we are able to find out where the patients, and then to isolate them, then to take care of them. This may have the double effect. One effect is on the side of the isolation of the patient, quarantining them, and then containing the spread of the disease. While on the other hand, it is going to benefit us immensely in providing accessible healthcare to the persons, so that if we reach them early, we give them pulse oximeter, we monitor their progress clinically, because we know that they are the COVID positive persons, and also the people who are comorbid, above 50 or below 15. If we reach to them very early, then we are sure to reduce the fatality rate. And that is what actually is aimed for.
Dr. Mishra, you also thought of, for the contact tracing, which we were just discussing a while ago. What brought to your mind that, you should involve tehsildars and corporators and local MLAs and allocated them different responsibilities, like the way the postman knows almost every household. So tehsildar knows almost every household. So how is it? How did you go about it?
Thanks for reminding. Actually, we tried everything what can be possible, and you see, in disaster, we look for every opportunity to interact with the people. We made large number of social media groups. We try to interact with the councillors in their group, MLAs in their group, and also try to keep them separate so that political things tussle of Delhi, they may not spoil our effort. The RWAs also, and we try to put in some of the informations if we cannot disclose with the details of the patient, and some of the informations that, see, this has occurred in this particular vicinity, how many of you have got in contact with them, are sending our executive magistrates to those areas to find out the contact tracing. In fact, all dispensaries are assigned to contact tracing, and believe me, we have like right now I'm having 2,800 cases in district. So all 2,800 has been worked up on a separate word file on computer, and each contact tracing has gone up to from 50 to 500 people, and all across not only Delhi. Some have traveled to UP, some have traveled to Bihar, and we are informing the concerned district magistrates. So this, of course, is a tremendous task, but we have tried to do it beautifully.